Hey, it's good to hear that music on this Wednesday afternoon. We always like that because it means it's time for Helping Seniors of Brevard. Let's get things underway. Here is the host of Helping Seniors of Brevard and the Executive Director, Kerry Fink.
Well, thank you, John Harper. It's always pleasant to gather at the radio every Wednesday. It's our lunchtime gathering for the Helping Seniors of Brevard radio show, heard each 12 noon to 1 p.m. right here on 90.3 FM WEJF. And welcome to those of you listening online, WEJF.net. And also those of you who will catch this as a podcast when as soon as we release it, because pretty much as soon as we're done with this and it's aired, it goes over to wherever you get fine podcasts. So that could be anything from, Apple iTunes to maybe you look things up on Alexa or however, Spotify, iHeartRadio, you will find Helping Seniors of Brevard there. And so on behalf of our president and founder, Joe Steckler, and Nancy Deerdorf, our operations director, want to welcome you into another fun but educational edition of the Helping Seniors radio show. And I'm excited because if you were with us this time last month, we were talking with I call him the world famous Dr. Lee Sheldon. And we had so much fun on the radio last month. Dr. Lee Sheldon, for those of you, I can't imagine you might not know who he is, but he is a noted area periodontist, solid bite dental, Dr. Sheldon Furtado, right there on Sauna Road, been voted best of the best dentist. I don't know how many years in a row now, but he's been a longtime friend of the Helping Seniors organization. And we had so much fun this time last month. If you get a chance, look up the July 15th radio show podcast. It was called True or False, and it was just a great time. Dr. Sheldon, how are you today?
Good, Kerry. It's good to be with you as always. And yes, I have prepared another trivia contest which will challenge you and Jim and John and all.
See, I love this because now last month when we did this, again, I want to remind you, every time we do these things, we archive these because what we have found out is people like to go to the library and pull these things out later. You can go to helpingseniorsofbrevard.org. You can pull up any of the TV shows that we've done together, the radio shows, all the articles published in Senior Scene magazine, Joe's columns in Hometown News, you just name it. It's a great resource location, helpingseniorsofbrevard.org. But then we have a YouTube channel called Helping Seniors, and then we have a Facebook page called Helping Seniors. We put these there. So here's the thing. So Dr. Sheldon, who almost always has a very serious and helpful topic for us. We've covered so many great things along the way. But last month he said, let's change it up and let's do a true false quiz. And let's see, let's get an idea of how your dental knowledge stacks up. Now, so in full disclosure, I had the crib sheet last time. So I had the answers. So as Dr. Sheldon was reading these questions, I kind of knew where we were going. This time, I don't have a clue, Dr. Sheldon, because I don't have that crib sheet.
And not only that, Kerry, but it's not true and false.
Oh. Well, hopefully I don't have to write an essay, right?
I was going to send it to you this morning, and I said, nah, why bother?
Well, so with that, I think you told me, though, we have 7 questions that we're going to try to unravel the dental mysteries with today. So this is your chance to play along just like you would if you were on Jeopardy or some other great game show. So Dr. Sheldon, are you ready to roll with question number 1?
I am ready to roll, and we will begin with, we're going to start easy, and then we're going to go a little bit more difficult and a little bit more difficult and a little bit more difficult. So we start with question. How many incisors does the human adult have?
Oh, wow.
Now, I will give you a hint if you would like.
I'll take all the help I can get.
Okay. The incisor is the tooth that's responsible for biting into a sandwich.
Uh-huh. So, Jim or John, do you want to weigh in on this before I hazard a guess?
Okay. Well, there's not much that I can weigh in on because my intelligence factor is way, way below either John Harper's or Dr. Lee Sheldon. But I can think about it. I mean, I'm thinking on it. How's that?
Yeah.
All right, let's think about it.
I'm imagining these are like your sharper teeth, right? So what is it like?
These are the teeth that tear, yes, in the front.
Yeah, I've got one of those. just one. But hey, it's okay, Dr. Sheldon. I mean, it's one of those things that I
Are
have,
these the canine?
No. The canines are already gone. When I was a kid, and honestly, Dr. Sheldon, you know this because we've talked about it before. When I was a kid, I had braces for 4 years. And then after I had the braces taken off, I had all these little pinhole cavities around. And years ago, dentists used to sit there and hollow out your tooth. And they used to sit there and fill them full of amalgam, which means that they were like an M&M with a thin candy shell made of lead or something like that. So yes. At any rate, what happens when you're 40 or 50 years later, when you're like 70, 75, like I am, then those thin candy shells start to, crack and break and fall apart. And if you lose a filling, the whole thing goes. I mean, it's really, it's not a really good situation. I know a lot of people who are in the same boat that I am. Then you go to the dentist, and the cost is pretty much what prohibits us from getting stuff dealt with. Of course, Dr. Sheldon is so generous that, I'll be down there next week. And no, seriously, he is generous. Don't get me wrong. He's a very generous person. But, it's the committee, it's the community. I mean, Medicare doesn't cover a lot of dental stuff, and they should. I mean, dental work can cause you all kinds of problems with your heart, and it can cause you problems in other health areas as well. And like you've often said,
that's a whole topic of discussion. Yes.
Well,
right.
yeah, I was thinking Jim is doing a great job of giving me a chance to look this up on the internet, but I did confirm my answer. I did confirm my answer was what I was thinking, right? Because the question is, how many incisors do we have, right?
Well, I'm still thinking.
And by the way, John asked the question, is it the canine? And the answer to that is the canine is the dividing line between the incisors and the premolars, so it does not include the canine.
Wow.
Oh, okay.
That's even trickier.
Yes, it is.
Does that help?
Well, sort of. So somebody want to hazard a guess? John,
and
your
remember,
answer
you
is
have upper and lower incisors.
It's like a pair of scissors?
It's like a pair of scissors.
Oh. Well, maybe it's those two little teeth in the bottom there that are like 5 teeth out or 6 teeth out. Maybe you're a vampire.
I am waiting for a number.
How many they
have? What's the number?
4. How about 4?
You're right. There's 4 on the upper and
4 on the lower.
That's right. Total of 8. Very good.
Wow.
Listen, sometimes when I think, I make I make progress.
All right. And then moving right along, question number 2.
Okay, question number 2. All right. While we're counting teeth, how many baby teeth or how many primary teeth does a child have? These are the teeth that get loose and come out. So these are the primary teeth that are all out usually by the time a person is years old.
Wow. Doesn't a full adult have like 32 teeth or something like that? I don't know if even that's right, but I'm going to hazard a guess and say 28. I don't know.
Okay. Who else is guessing? Kerry, what'd you say about permanent teeth? I missed the cut off.
I was wondering.
Permanent teeth?
I said 32, but I have no idea if that's right or not.
You are absolutely right. 32, including the wisdom teeth. 32 is the number of adult teeth. So now, how many baby teeth are there?
All right. Kerry said 28. Jim, John, do you guys have a guess?
Said 28.
32.
Okay.
32.
John.
I'll go along with that.
John's going to go along with me. We're both going to be wrong together. So go ahead.
The number is 20.
20?
So
everything,
that's right. Everything that, remember, you have a 6-year molar that comes in. That's the first permanent tooth that comes in when you're 6. Everything in front of that are the baby teeth. And so that's a total of 20.
Wow.
And the reason we have, essentially the baby teeth are there, besides chewing, it holds the space for the permanent teeth in the front. Those baby teeth have roots on them. And as the permanent teeth develop and they erupt, the roots get shorter and shorter until the teeth get loose and they come out.
But does the tooth fairy come and give her money for all those 20 teeth?
And how much does a tooth fairy pay today, Jim, versus how much does a tooth fairy pay 50 years ago?
Used to be a dime or a quarter. I don't know what it is now.
The tooth fairy probably uses PayPal or something like that, right?
Uses the kid's MasterCard, you know?
Well, I don't know if this is officially question number 3 in the quiz or not, but I am interested. Dr. Sheldon, in your medical journals and everything that you study, is there a going rate for the tooth fairy these days?
I haven't asked. I ought to ask my son and my daughter-in-law. They would know better than anybody else. So those are my local people. But I've got another son and another daughter, and I can ask them too. And let's see what the going rate.
I think that would be so good to know. I do discover that each year as I go along, I sound more and more like my own father, who would always come up with completely irrelevant prices for things because they were based on when he was a child. And I find myself doing the same thing, but it's all part of it. We're talking with Dr. Lee Sheldon, noted area periodontist with Dr. Sheldon and Furtado. And we are in the second part. We called it true false last time, but he's giving us trickier questions to test our dental knowledge. So we just had two really good questions, which was, I think we just covered how many, first was how many incisors do we have? And then how many kids' teeth do we have as we're starting out? And I really was surprised at that answer, Dr. Sheldon, that you told me it was just 20 but your explanation made a lot of sense for that. So with that, are we ready to scroll ahead to question number 3?
Well, I'm not sure about question number 3, but I'm gonna run question 3 by you before I ask the question. Are any of the 3 of you baseball fans?
Yes, John is.
Yep, Jim is.
John is, okay.
I like the game, but I'm not an expert.
All right, John, then this is for you. Those of you who want, and by the way, you this goes many years back. Okay, here's the question. What dentist who practiced in Hanover, Massachusetts, led the American League in wins, strikeouts, and games started as a pitcher in the 1967 Boston Red Sox Impossible Dream?
Red Shandings.
Well, Red Shandings is a good guess. Is around the same age. Any other guesses?
Carl Yastrzemski.
Carl Yastrzemski was on that team. My goodness, that's good, Jim.
Well, that's
now, but Carl Yastrzemski was the left fielder on that team. We're talking about a pitcher.
Trying to think. Thinking's really hard for me, but go ahead.
All right, good. I'm going to give it to you because either you have it or not. Jim Lonborg.
Okay, right.
Jim Lonborg was a fabulous pitcher for the Red Sox. He led the Red Sox in games. He played for another probably 6 or 7 years. Then he graduated from dental school in 1983. And he stopped practicing in 2017. So he had a full baseball career and a full dental career.
But I don't have his baseball card.
Well, you got to get his baseball card. And now you're going to look up on the internet to find out who Jim Lonborg is.
I'll bet Dr. Lee, his practice was just loaded with Red Sox fans.
It had to be. He was in Hanover, Massachusetts, which was probably, I think it's probably 30 or 40 miles
Where's
south
that at,
of
Jim?
Boston.
I think so. I think it's about there. It's kind of southwest of Boston, isn't it? I think.
I'd have to go to a map.
Oh, let me go. Yeah. I'll go look right now.
Yeah, go ahead.
But anyway, a suburb of Boston, wherever, and I'm sure Dr. Lee Sheldon, he must have just had a waiting list of Red Sox fans who wanted him to work on their mouth.
Well,
I'd love to have him working on my mouth. Of course, one of my friends was his teacher in dental school, so I got a play-by-play on that one too.
Wow.
Was that your dental school teacher that you told the story of a couple of weeks ago on the air?
No,
this is a
that
different
was
one.
in the Army. It was toothbrush. Oh, let me get this. Oh, I'm so close. Toothbrush. I would say Colonel Klink, but that was from Hogan's Heroes.
Nothing. I know nothing. Go ahead.
Toothbrush Thompson.
Yeah.
There was an alliteration.
And that
in there.
was
That's
a-
where that. Yes.
By the way, gentlemen,
That's right.
Hanover is it's in the vicinity of Boston, but it's way down on the vicinity. There are other towns that abut Hanover. That's Hanson, Mass, Norwell, Pembroke. That's a lot popular, and Rockland, those are the ones that really abut Hanover. And I'm pretty much correct when you look at where it is on the map. It's a little west, I think, more than anything else. So let me just one more thing here. I'm pretty sure that's what we're.
Must be pretty close.
I'm good with Google. But like I said, I can't think. So
Yeah.
That's how it goes. Now we can't read maps because we use GPS, and now unless we can access Google, we're in trouble with answering questions.
Right,
But we are talking with Dr. Lee Sheldon, and we are in the middle of a dental quiz, and we get bonus points if we get most of these rights or something like that. I remember asking Dr. Sheldon as we wrapped up the edition we did on this last month, which was so much fun, back on July 15th. The question was, it was a true or false quiz, and I asked him at the end, they always give you these little scores. There was I can't remember how many questions it was, but you get to a certain point, and then if you got, 5 of 5 right, then you could be a dentist yourself or something like that. But I think you gave us a pass and said if you got 2 out of however many questions it was, you considered that plausible for mere dentricians, I guess, if that's a word. So, so Dr. Sheldon, as we move forward on the Helping Seniors radio show, we've now had 3 of the 7 questions. Let's go boldly into question number 4.
Okay, question number.
One thing, Kerry, Hanover, Mass. is in Plymouth County and is actually a little southeast of Boston. So I just want to let you know that it's in Plymouth County. And I did look at the map, and thank goodness for Google. Go ahead.
There you go.
Kerry, before you get on to question number 4,
yes.
Dr. Lee Sheldon, did the dentist, the Boston Red Sox pitcher, did he have a specialty when he was practicing?
No, John, he was the general dentist.
Okay, all right.
The tooth catcher, I don't know. Probably not. Okay.
That would have been cool. That would have been.
Yeah.
Anyway,
so, all right.
All right, question number 4.
Now that you led into this, I have a question that involves specialties of dentistry, but I think I'm going to, we're going to the break, and we're going to do one, and we'll get into specialties of dentistry afterwards. So after the break, all right. What are the 2 main components of a silver filling? Now, I've given you one of them, silver filling, so you know that one. What's the other one?
Amalgam.
Amalgam is a combination of all of them together. It's called an amalgam of there's, for most, there's 5 basic metals, but there are 2 metals that are most prominent in a silver filling. One is silver. What's the other?
Lead.
No,
I wouldn't think they would let us do that.
Mine was probably lead, because that's why I think about it so much.
So silver and, it's not gold.
Got silver, and it is a liquid metal.
Mercury.
Yeah.
Mercury is the answer. That's correct.
And is that true, Dr.
Go ahead, Gary.
No, I was just going to say, and is that why we don't really use those fillings so often today now?
I think, those fillings have gradually been outmoded for a number of reasons. Some people will do it according to health. They will make that claim that it's better not to have those fillings in your mouth. We tend to expand on that, but we can talk about that privately, though, as much as you want. But when good composite fillings, which are white-colored fillings, and they match the tooth, when they came out and when they became stronger and more adhesive, then they replaced the silver fillings simply for cosmetic reasons.
Yeah, they look
less
better.
drilling when you're doing that kind of a filling than you do with the silver filling.
Had nothing to make you mad as a hatter, right? The mercury.
Well, that's true. The mercury.
Mercury. Yeah, I mean, there was the claim that mercury fillings are inert and they don't hurt you, but there have been a number of studies to show that, in fact, that's not the case, that mercury does leach out of the silver filling, and so there, and we tend not to take stands on that because...
Well, that's my excuse. But I mean, that's my excuse.
You can... It's true. When you put a silver filling in, you actually had to drill out more of the tooth because there was no adhesive property to the silver filling. So you actually had to put undercuts into the tooth in order to be able to keep the filling from falling out. So you had to do more drilling in the tooth and filling work. So we've never done silver fillings in our practice. Matthew's been in our practice for 12 years. We have never done a silver filling. So, and you'll find that most practices, I don't think you'll find silver in very many practices anymore.
Right. And this is one of the things.
The other thing
I was going to ask Lee, when you first started, did you use that practice?
I missed that. I'm sorry.
When you first started in dentistry, what were you using for fillings?
When I first started, it was silver fillings, or we would be doing cast gold. We were also, at the time that I started in dentistry, John, we actually did have composites. So we did have they were used on front teeth, but they weren't durable at that time, durable enough to use on back teeth. They would wear away too fast. And so somebody would have to replace the fillings often, and you wouldn't tend to do that. So in the back teeth, we're using silver as the less expensive type of filling, and in the front, we were using the white filling. And then as my career developed, then created more durable components to the white filling, and so then you could put a white filling in and it would last a very long time. And it would have an adhesive property, so it would stick to the tooth, and therefore there wouldn't be a space between the filling, a potential space between the filling and the tooth where bacteria could get in. There was actually adhesive property, so it sealed the tooth better.
You know, that's one of the things that always is interesting to me, Dr. Sheldon, just in general, when we're talking about the process. You have been doing this for a while, and yet you're always staying on top of whatever the latest advances are. And I say advances because, just as I've heard you talk about everything from perioscopes to all kinds of technologies that you've really helped kind of usher in as things move along. It's fascinating because I guess in your career, you've been able to watch so much get so much better for so many over this time.
Oh, I have. And just this morning, we are doing an update on our periodontal and systemic health part of our practice. And so I've been working in that area for quite some time. There are lots of claims that are made, and we don't go with the claims. We go with what is proven in the literature. I spend an awful lot of time with our laboratories to identify different bacteria that go on in the mouth. So there's a lot of stuff there that's very interesting and can be very beneficial to patients.
Sounds good. Talking with Dr. Lee Sheldon. We'll be right back with the second half of today's Helping Seniors radio show.
And as that music gets underway again for the second half of Helping Seniors of Brevard, let's continue with more of this discussion this afternoon with your host, Kerry, Fink, and Dr. Lee Sheldon.
Well, thank you, John Harper. Good to be back for the second half of the Helping Seniors radio lunch hour, where we get to gather around the radio, enjoying all the good conversation on 90.3 FM, WEJF, and online at WEJF.net. And again, if you're listening along as a growing number who do find us as a podcast, welcome back, or welcome as we continue. We've been having a great fun show today. I reference back to, one of the things when Joe Steckler, who's our president and founder, he organized the Helping Seniors nonprofit going back. We're now in our 13th year of service in Brevard County, 100% local to Brevard County. We are dedicated to making things better for seniors in our area. And one of the ways we do that, in addition to having the Helping Seniors info line, which Nancy Deerdorf, who's like 33 years registered nurse experience, manages and oversees all the 5,400 plus calls that we took last year. And this year seems to be set to be another record breaker on that, just simply because the number of seniors keeps growing, both in terms of number of people who reach seniorhood. I think the statistic is like 1 every 8 seconds, somebody's turning 65 in the country. But then also in particular here where we live along the Space Coast of Florida, and Florida in general is just growing because so many people are saying, I want the warm weather, I want whatever, and I'm coming to Florida to enjoy my golden years. So there are so many folks moving into this. And then the other thing that we find so often that we get the calls for on the helpline is from adult kids who are trying to help their parents do the best they can in their senior years while they may be up north or out in the Midwest with their careers or whatever and trying to help mom, dad, aunt, uncle who has decided to enjoy the Florida sunshine. But the other point that Joe has always stressed is we got to get information in the hands of people so they can make good decisions. And our guest today is Dr. Lee Sheldon, who's noted area periodontist. He's helped Joe and me and everybody connected with helping seniors all the way through from the day that Joe established helping seniors. In fact, Dr. Lee Sheldon goes back when Joe was busy building the Joe's Clubs for Brevard Alzheimer's. And so it's really been a big part of making sure that we're doing the right things that help seniors. In fact, Dr. Sheldon, I just want to stop down for a minute. I know we're in the middle of a fun quiz. We've gotten 4 out of 7 questions in today's kind of like, how good are you at dental? What's your dental IQ or something like that? I don't know what we call this, but you have made it possible, for example, for people to get really good a good handle on what's going on with their own dentistry because you came up with a really innovative program that is kind of what I call a win-win-win. It's a plus for helping seniors because it ends up being a fundraiser. I think you call it Sheldon and Furtado, A Solid Bite Gives Back, but it's also very good for the person who comes into the office because they're getting an incredible full comprehensive evaluation of everything that's going on dentally so they really can have a plan and understand what's happening. But then it's also a win for you as a dentist because you invest the time so you really can correctly guide the person coming in the office so there's not really guesswork or things going on. Can you just, before we jump back in the quiz, just take a quick lap around the track, explain how that program works, and if somebody wants to get involved, how they would do that?
It's true, Kerry, because when I began my practice, I just would not come into me for just a quick examination and a cleaning. That isn't the way I wanted to practice dentistry. I felt that it was incumbent to give a patient a full evaluation and give expectations as to what's going to happen in the future, what we can do to prevent things, and what we do to repair things, and what we do in order to be care over your lifetime. And that's the way I've always practiced. Some people spend a lot of money in our office. Some people spend very little money in our office. That is the point. The point is to be able to deliver a service that's predictable, and so that money isn't wasted. And so I need time to do that. And so from the moment that we started, that was the way to practice and to do my examinations. But those examinations became awfully expensive. If you look at the amount of time that we spent, the examinations became cost prohibitive because I want a CAT scan for every patient because there are certain things I can discover on CT scans that I can't see on regular x-rays, and I wanted a full set of x-rays, and I wanted time with the patient to be able to understand so that I could help the patient with different alternatives at different price points, if you will, in order to be able to come up with a comprehensive plan. So when the exams became so expensive, I said, the heck with that. Let's do something different. And what we did was to put in the Solid Bite Gives Back program, where you pick one of the charities in our campaign, our Solid Bite Gives Back campaign, and you write a check directly to the charity for $50 or more. And Helping Seniors of Brevard has always been a big part of that program, so that anybody who's listening here can say, I want to be part of the Helping Seniors of Brevard program. And when you call our office at 321-259-8000, and you'll know what that is. Essentially, it means that on the day of the examination, you bring a check, you write a check for $50 or more to Helping Seniors of Brevard. You get the CT scan, the full x-rays, and the time with me to to talk about what your needs are, and that's it. You get it for free, just as a result of writing a check to Helping Seniors of Brevard, check to us, and we mail it to Helping Seniors of Brevard.
That's what I really appreciate about it, because it's that creative thinking that makes things go, because everybody gets what is helpful in that case out of a combination like that. That's one of the things that's always been kind of like an effort of Joe's whenever, just in setting up how we do what we do with Helping Seniors. We're always trying to make sure that people, when they call Nancy on that senior information line, that free call 321-473-7770, that they're getting excellent help and advice. I mean, we're a tiny organization. I always say to Joe and Nancy, I feel like we're the little engine that could, because I'm surprised, as such a small nonprofit, what a big footprint we're able to have. But it's the fact that Nancy really goes out of her way, and everybody who's also on the phones helping on that, Karen Wernland, who is who spends a lot of time helping Nancy with the phones these days, just because the volume is getting just to the point it's more than a single person can manage. But they really try their very best to figure out where good resources are in the community, and to that point. They really have put together kind of like a manual. So when you call in and you say, well, here's what I'm facing, or this is what I'm trying to resolve, they have some really good resources and can usually put somebody in touch with something that makes a difference. And I'm really surprised how often it's helpful. I mean, literally just today, was hearing a story where, it was a case of somebody calling in and they were trying to resolve a housing situation. And through a collection of networking efforts, they were able to get that one solved. Those are the kind of things that happen every day at Helping Seniors. So I'm going to reserve a little time at the end of the program to give you another way beyond Solid Bite Gives Back that you can help us in the Helping Seniors world. It's the Helping Seniors car raffle. We'll talk about that. It's our main fundraiser of the year. But right now, let's jump right back in. We're already waiting to see if we can come up with an answer to question number 4 in the Dental IQ quiz put together by Dr. Lee Sheldon. Take it away, Dr. Sheldon.
So John Harper, before the break, asked whether Jim Lonborg, the pitcher for the Boston Red Sox, who was also a dentist, whether he was a specialist, and I said, no. Jim Lonborg was a general dentist. I'm sure quite a good general dentist, given his art as a championship pitcher for the Red Sox. But that led me to name the 6 specialties of dentistry.
Well,
okay. Periodontist, right?
All right, you got me. So I'm periodontist. That's number 1. Very good. And the periodontist works with gums and does dental implant surgery, but essentially takes care of the diseases that cause tooth loss. But if you treat periodontal disease in time, you can save most teeth. So that's what the periodontist does.
Okay.
Give me a number 2. Or did you already say it? Did I drown you out?
I'm going to say orthodontics.
Orthodontist is number 2. So that's the one who stretches teeth, braces, and that type of thing. Good. What's next?
There's one called, is it endodontics? Am I saying that
There's
right?
the endodontist. The endodontist is the one who does the root canals. That's correct.
yeah. Okay.
Okay, now it's getting tough.
Help
me, guys.
We've got 3 out of the 6.
What about the surgeon? The dental surgeon?
The is number 4. Thank you very much.
Good,
so
Jim.
that's good, Jim. We got number 4. So we've only got 2 left.
Wow, now this is really tough. Let's see, what have we not covered?
Dental hygienist?
I am ready for hints whenever you want them. So if you want me to give you a hint, I'm happy to do so.
There's no pride in this land. Help us.
Okay, think children.
Oh,
Dentist.
Kid
Pediatrics.
dentist or a pedodontist or an oral pediatrician. They call them oral pediatricians now, I think, more than anything else.
okay. All right, well,
Okay,
that
and
makes sense.
there's one left, and I don't know if you're going to get this one, but I'll give you the hint. The specialty of dentistry that specializes in tooth replacement.
False teeth manufacturer?
That would be the laboratory, but okay.
I would have it
It
guess
could
and
be,
say-
actually, it could be this person as well. I'll give this one to you. I'll give this one to you. Okay, this one is
The
I'm
what?
hearing dead air on the other end. Is it my phone or is it? I've never heard of a prosthodontist before. Which one is it?
I don't know.
Wow.
Prosthetics are like arms and legs, so I guess it would be a
That
prosthodontist
would
would be for teeth.
You would
Exactly
think.
right. So prost would be was artificial and dontist meaning teeth. So absolutely right. Yes. Six specialties in industry, but I kind of fibbed a little bit. You know,
No,
I
not
kind of
you.
fibbed.
No.
Yeah, I kind of fibbed. There is a seventh specialist in dentistry, but it's one that's not found in the dental office, or usually not found in the dental office. Can you possibly think of what specialty that might be?
Well, I'm going to hazard a guess. So I can't even say the word right, but I think I've heard it before, but I don't know that this is even right. It's a maxillofacial or something like that.
That's true. The oral surgeon became an oral and maxillofacial surgeon. Originally, they were oral surgeons, and now they're oral and maxillofacial surgeons because it became much more of a specialty than just replacing teeth. And so they move bones around, they correct bad bites and things like that surgically. And so maxillo refers to the upper jaw, and facial is the entire face. So they can combine those two words and made it maxillofacial surgeon. So the oral surgeon now graduates from school not as an oral surgeon, but as an oral surgeon. But this specialty of dentistry is one that you ordinarily don't see clinically. You don't see this
Cosmetic?
person directly.
Cosmetic?
Yeah, the cosmetic dentist is somebody you would see likely because you're working on your smile. This is something that
I've seen
may
my
be
picture.
akin more to biopsy for.
Oh,
So you have a regular pathologist that we have a big pathology group right here in Melbourne and all around Brevard County in our listening area. This one is an oral pathologist. The oral pathologist is one who specializes in oral diseases only. Biopsy in our office, we send our biopsy up to the University of Florida where they have 3 oral pathologists.
yep.
The oral
Wow.
pathologist has been a valuable part of our practice, and you almost never knew it, except that you would be charged a little bit of money for the pathology report. But the pathology report essentially allows me, when I was in surgery, if I found something that was suspicious, I could take a piece of that. I would then put it in formaldehyde or something along that line, and send it up by FedEx to the University of Florida, and they would give me a report back. In addition, and even now, I just do diagnosis now in our office. I've done that for several years. But if there's a patient, I'll take a picture of the problem. I'll send it up to the oral pathologist. I will, and I know the oral pathologist. I've been working with one of them for years, and so I can mail a picture up of what I see, biopsy, of course, but there'd also be clinical signs and symptoms. Here's what I've got. What do you have available? And even when a patient has a medical problem, I can send to the oral pathologist, and the oral pathologist, because he's working in the University of Florida system, can lead me to the right person to go to if we need a special surgeon or even if we need somebody on the medical side. So the oral pathologist is extremely valuable, but you've likely never met an oral pathologist.
Interesting. Well, it's funny as we kind of take a deep dive into all these different topics. You said this would be a little tougher than the true false. And I have to say, I like the true false best because it gives me a 50-50 chance of at least getting it right. But as we plow ahead, this would be, let's see, I think we're on question number 6, right?
We are on the last question that I've designed.
Okay.
Okay. Now, some of you in office and understand what this is all about. Others have never had the need for this. And since I don't know your dental situations, I don't know this for a fact. But there are 2 ways of making a dental impression. I'm not talking about greeting somebody and being friendly. It's not that kind of impression. I'm talking about the impression where we act a representation of what the teeth are, what's in the mouth. There are 2 different ways of making a dental impression. What are the 2 ways?
Well, I guess you stick the stick those little gummy things in there and you bite down on them. I don't know what it's called, but that would seem like one way. And it would seem like the other.
Yeah, that's the goop. That's the goop type of impression. You have a tray, you have a jelly in there. You take the tray with the jelly, you put it over the teeth. The jelly hardens up, you pull out the impression, and that way you can make a model of what's in the mouth. So that's right, that's the traditional impression.
Is that what you guys call it in the dental world? It's the goop method?
I thought it was cement, right?
Well, I would guess though, because I've seen you use it so often in the dental office, but I'm not sure it's how you do it. Is it the CT scan?
The CT scan, it's close to that because we actually use the CT scan and we match it with this digital image. We actually have a camera, a little wand that goes in the mouth and it actually takes pictures of the teeth and gums. And we can interface that with our CT scan when we're doing our computer planning for dental implants. So the answer is a digital impression done with a camera rather than with goop.
Which is a lot easier.
And people are far more comfortable with that because you don't have the goop in the mouth. You can take pictures. You can take a break if you want to. Essentially, the wand will go all over the mouth, and we're just holding the wand, taking pictures, and we see the pictures on the screen. And if we miss a spot, we know where we've missed a spot. We can take another picture. We can take the bite registration, all with the camera, and it's all interpreted in the computer. Very easy, and quite a bit more comfortable than the traditional impression.
So once again, advances in dentistry, we were talking about earlier in the quiz. I mean, to me, this is always fascinating because you go back to, I'm thinking about you and Toothbrush Thompson, and you go all the way back and you have, kind of what the, I guess the state of everybody's expertise was at the time. And even Jim Votro was saying that earlier in the show. It's like, back in those days, it was drill, 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 hollow out your tooth and, whatever, trying to solve a cavity. But it seems to me, especially talking with you, Dr. Lee Sheldon, that you're much more concerned about overall mouth health. And that so when you look at somebody, you're really trying to get them, to see all of that the right way.
It's true. We've got, I mentioned earlier in the show that I was just did a 1 hour Zoom call with our laboratory in Minnesota. And this isn't a laboratory that we're using for designing teeth. This is a laboratory that helps us identify the bacteria in the mouth so that we can be better equipped for the disease the patient has. And this laboratory is run by a physician. He runs a number of different saliva tests that we can do. And he's even doing a test where he's developing a test, and we're going to be on the pilot program of this, where rather than mail the saliva sample out to the laboratory.
So we're talking with Dr. Lee Sheldon, noted area periodontist, and we're talking about some of the advances. We've just been doing a great quiz and having a lot of fun trying to see if we could. I guess it's not really stump the radio guys because we're easy to stump, but but these are great questions you came up with, and you were talking about, Dr. Sheldon, about this advance in how you can actually, instead of having to send saliva samples off, and it sounds like there's a way that they're even simplifying that these days.
Yeah, I mean, so for a little test, we can identify the main bacteria that's in the mouth, and we're going to be in the pilot program with that. I mean, there's a lot of exciting things that are going on. The excitement has to do with improving a patient's health. And most of these things are very low cost items in order to be able to identify bacteria and to be able to help a patient control or get rid of a disease. It's just fascinating. It's a great time not only to be a dentist but also to be a patient, to be able to take care of or take advantage of new innovative processes that are making it easier, more predictable, and even less expensive to have good work done.
No, it's great. Thank you, Dr. Lee Sheldon with Solid Bite Dental. Dr. Sheldon and Furtado right there, a famous fixture. You drive right down Sarno Road, which is close to the American Muscle Car Museum, which I'm going to talk about here in a minute. But before we get there, Dr. Lee Sheldon, I thought this is great. Now we have two of these dental quiz shows in the Helping Seniors Radio archive. So you could almost say, if you listen to both shows, you've completed your undergraduate in introductory dentistry if you answered these questions correctly. So, but Dr. Sheldon, seriously, if somebody says, hey, I have a further question, I heard you guys talking about this, or hey, I heard you guys talking about that fundraiser for helping seniors, I want to get in on that and maybe have you see what's going on with me or whatever. If they just want to get in touch with you, what's the best way to do that?
Yeah, just give us a call, 321-259-8000. Say that you heard me on Helping Seniors of Brevard. Our staff will know exactly what to do to set up an appointment for you.
Wonderful. And so with that, Dr. Lee Sheldon, we're going to take a moment just to talk about the Helping Seniors car raffle, because that is coming up very, very quickly. It is Saturday, October 7th. It is the greatest automotive night along the Space Coast. Well, at least I would say that, because Mark Pylock opens up the doors to his American Muscle Car Museum, and that is the showplace of showplace. We are so fortunate that Mark chose our little humble hometown of Melbourne, Florida, to put such a fantastic world-class, probably the world-class collection of automobiles right here in our backyard. And since it's basically his private garage, the only time that you can really go in there is when he's helping charity works. And we're so grateful because ever since he opened that up, he's allowed us to come in and be part of that. So when you get your Helping Seniors car raffle ticket, you get your admission to the museum on the night of the grand drawing. And what a night that is. 6 p.m. to 9 p.m., Saturday, October 7th. He opens up the museum. And not only that, Mark is a terrific host. He provides the beer, wine, soda, water, snacks. He had pizza out there, sandwiches. Dr. Sheldon, you were there last year. You know what a great night it is.
It is, and Mark has a new collection every year. It's like you haven't been there before. Oh, there was some repeats. No, I don't know, overstate it. But Mark, a dynamic collection. He trades. He gets new stuff in. He gets rid of the old stuff, and the food's great. Company is great. It's just a wonderful event.
It is so much fun, and it's included with your ticket. So you don't have to be present to win, because when we pull the winning ticket, that's it. That's who gets the new car. But you get your choice of a car. And so also you got to get your ticket. How do you get them? You can stop by Dr. Lee Sheldon's office, because his office has the tickets. You can call Nancy, 321-473-7770. You can get them safely and securely online at helpingsseniorscarraffle.com, or you can go to any of the Boniface Hires dealerships. You say, hey, I might want to win that Chevy Camaro. So you could run by Boniface Hires Chevrolet right there on US 1 and say, let me see that car that I'm going to drive home in. And then you could get your tickets right there while you're on the site. Or if you like the Dodge better, you could go check that out. But there's also a Mazda Miata convertible. There's a Kia Sportage, and there's a Mitsubishi Outlander. So it is really your pick, because they all come from AJ Hires' fine family of car dealerships. And Joe Steckler, our president and founder, he and AJ just go back all those years. And so this has really become a way that you can help us keep the Helping Seniors organization moving forward. It literally is about half of our budget every year. So we thank you in advance for getting your tickets. One is $25. $5 is a $100 donation. Each ticket you get is a chance to win, but it's also admit one to the museum that night. And so what we're finding out is, like, offices are just buying a bunch of tickets and bringing their whole staff down. And it just it's just a great gathering. Everybody has so much fun because Mark is such a terrific host. And then the fun part is somebody's going home with a new car that night. So you got to get your tickets. Well, that's the time we have for Helping Seniors Radio today. We'll look forward to seeing you back here next Wednesday, 90.3 FM, WEJF. Till then, happy helping seniors. See you then.